Welcome back. As the outbreak grows, the amount of information can be overwhelming. So every night, we're committing time on this program to answering your questions. With me tonight, Dr. Lenore Saxinger, infectious disease specialist at the University of Alberta, and Dr. Isaac Bogosh, infectious disease specialist at the University Health Network in Toronto. So let's get right into it here. Since the virus's impact is mainly on the lungs, causing pneumonia, does it mean that seniors who've had a pneumonia shot will have a measure of protection from the virus? We'll give this to both of you. Let's start with you, Dr. Bogosh.
Yeah, so certainly we know that seniors are supposed to get this pneumonia vaccine, but this vaccine itself will not protect them from getting this COVID-19 infection. It will help, however, if someone has a co-infection, meaning they get a bacterial pneumonia on top of it. This could protect against bacterial pneumonias that may be superimposed, but it will not protect against the COVID-19 infection.
I would just
Dr.
add that so far there's really no evidence that there's a particular pattern of co-infections in COVID-related disease and what types of bacteria are the most common causes of those, but I completely agree that this is a reasonable step and really should be done for seniors anyway.
Okay, Dr. Saxinger, next one for you. Should we avoid using reusable grocery bags during the COVID-19 outbreak?
Grocery bags have people upset, and I think part of it is because there was a study suggesting that the virus is still viable on plastic after about 72 hours. But I think people should pay attention to what they are doing with their belongings and where they've been before assuming that things carry risk. And I think that your options would be a reusable bag that you can wash frequently, or a single-use bag that you can dispose of, which of course is environmentally less friendly. And finally, anything that you carry that might have virus contamination, you can get rid of your risk by washing your hands thoroughly after you touch things, so upon coming home from shopping. So the simplest thing is managing your hand hygiene and thinking about the places you've been.
It always comes back to washing your hands. Dr. Bogosh, if someone has recovered from COVID-19, is it possible to get it a second time?
The short answer of that is that we don't entirely know now, but most people believe that if you've been infected with this virus, it's very unlikely that you're going to get reinfected with this virus during the course of this pandemic. That may change with time. Of course, we're still open to this possibility, but there doesn't seem to be much evidence for people to be reinfected after they've been infected with this virus. So I think people will likely have immunity for the course of this pandemic.
Okay, so one more question, just to toss your way here. Let's have a look here. What are you looking for in terms of how our public health system navigates the next stage of this pandemic? And we'll just do this with you, Dr. Saxinger.
I think that, so far, I think the public health response has been appropriate and measured. And what we're going to be looking for is continued stewardship of the things the community has to do to protect us. And we're going to be looking more into the health system response as well as cases increase in the community. I think I would like to see standardized reporting across provinces for better data handling as well.
All right, both of you. Once again, thank you very, very much. We get great questions every day and great answers from you every night.